Okay. Hi, everyone. My name is Lori Joyce, and I'm a project specialist here at MetaStar. And I wanted to welcome everyone to the second in our series on emerging technology trends to improve healthcare. It's a virtual learning series. And today we are going to be talking about improving healthcare access and outcomes with remote patient monitoring. And we're really excited to have Lisa Gall here with us. She is from Superior Health Quality Alliance. She works over in Minnesota, and she's going to be talking with us about this. Just a couple logistics so that everyone knows we are recording this. So, and we will be sending out the link. So you can most certainly share this with others who maybe weren't able to join us today. It will be available on MetaStar's YouTube channel. I also have posted in the chat a link to the slides that we're using today as well. So once again, if those are something you want to refer to, that is fine. And please feel free to use the chat with questions, and then we will try to answer those over the course of Lisa's presentation. So with that, once again, thank you so much for joining us today, Lisa, and presenting on this important topic.
Absolutely, of course. Thank you for the introduction, Lori. And we also have Mona Matthews here with us today. And so I'm encouraging them to jump in if I forget anything on going over the slides. So, feel free to do that, both Lori and Mona. If you advance to the next slide, that was MetaStar's cover page. This is Superior Health Quality Alliance, and the topic today is improving healthcare access and outcomes with remote patient monitoring. I am Lisa Gall, like Lori said. I'm a family nurse practitioner by background, and I have expertise in healthcare quality and technology. For the past 11 years, I've been a clinical program manager at Stratus Health and a quality improvement and advisor at Superior Health Quality Alliance, which covers Minnesota, Michigan, and Wisconsin. And I would like to welcome you to the overview of improving healthcare access and outcomes with remote patient monitoring. And we are doing this because as the healthcare system advances from electronic health records or EHRs to patient portals and telehealth, over the last 15 years, we're now moving into remote patient monitoring, which allows many aspects of health to be managed without a face-to-face visit. The objectives, what we'll be covering today, how to use remote patient monitoring with telehealth, how to help patients use at-home health monitors, and we'll briefly cover some information about billing and payment for remote physiological monitoring. Next slide, please. The ability to monitor, hang on, I got to shut my phone off. The ability to monitor certain aspects of a patient's health from their own home has become increasingly popular telehealth option, and it's really important to understand what remote patient monitoring is and how to implement and bill for it. So remote patient monitoring lets providers and patients manage acute and chronic conditions from their own homes. It cuts down on patients' travel costs and the stress related to travel for them and their family or caregiver. And these are the high-risk, vulnerable populations. Think about patients with no means of transportation, like those who live in the inner city or rural areas. Telehealth can also decrease the risk of infection through exposure to viruses and diseases at your healthcare facilities. Next page, slide. So we're going to start with a 4-minute video portraying a Mayo Clinic patient who shares her experience with remote patient monitoring as she works with her provider and nurses to manage her COVID symptoms at home. So Lori, I'm going to let you play that slide.
Okay, let's see if I can get this to work.
Looks good.
We formed the multidisciplinary COVID team towards the middle of March When we knew COVID was coming to the Midwest, our colleagues in Connected Care gave us the ability to manage these patients as outpatients. And given that nationally we were faced with a shortage of PPE and concern for how transmissible COVID was, this seemed like a very ideal process.
My name is Jan Lorimer, and I want you to know that I have 100% recovered from COVID-19. It had been days prior to going into the hospital that I was really feeling sick. And then to know that I had COVID, hearing the news, how people were dying from it, and especially the old people, which I was, and I had diabetes, so very afraid.
In Jan's case, once we had good data on her, we felt that she was going to be able to do remote monitoring.
What we do with our COVID patients is we work with patients who have some type of a comorbidity that places them at higher risk for their COVID infection to turn into pneumonia. And so we utilize technology. We send our patients a packet of equipment. They receive a scale, a blood pressure cuff, a pulse oximeter, a thermometer, and they also receive a tablet. And every day, somewhere between 2 to 4 times a day, our patients are asked to test their vital signs.
It also provided the nurses, and I had the opportunity and was encouraged to call them anytime, day or night, if I had a problem. And they were so good to me and good to my husband, if he had concerns. And so I just can't say enough about that program.
Jan was one of the first patients on our program for COVID. We actually had her and her husband on the program. Both of them were my patients. And I remember her because as soon as she came home from the hospital, she set up her equipment and she tested right away. And I remember her oxygen saturations were running a little bit low. So I was on the phone with her within an hour of her being home from the hospital. And we were able to talk that through a little bit, and I gave her some advice.
It was our lifeline. It definitely was. I mean, it just took some of that fear away because we knew that there was somebody still there taking care of us with our vital signs. It motivated us to do better on getting well. It really did.
The key to Connected Care is that they have really good nurses who can triage what actually needs to go to a physician and what doesn't. At the last time we ran our numbers, we're managing 800 patients remotely, of which roughly 350 were on Connected Care. And it was still manageable with a team of 1 to 2 physicians per shift.
The COVID infection has really raised awareness of programs such as remote monitoring, how we can use technology to bridge the care with the patients and their healthcare team, how we can keep a closer eye on patients, how we can provide more education to our patients. And we also have the right person doing the right role. So you're utilizing technology and you're also utilizing the registered nurse in a whole new way. Utilizing that registered nurse to work at the top of his or her licensure to provide that care for patients. I think it's super important, and it opens up a whole new future for more programs yet to come forward with connected care and remote monitoring.
Okay, that explains really well, I think, on how a remote patient monitoring program can be implemented.
Hello, I'm Eamon Costello, CEO of Patient Empower.
Oh.
Patient Empower are experienced providers of remote monitoring solutions across a range
I'll
of
just pause for a minute.
and use cases. Our platforms enable the clinical-grade remote monitoring of.
Okay, another remote patient monitoring webinar. There are many resources on YouTube, and that's where we found these snips. We have another one a little later, and then a third one that you can look at on your own. So as the popularity and convenience of telehealth grows, so does remote patient monitoring. More providers are implementing remote monitoring services for several reasons, including the advances in technology we now have, an increased awareness of telehealth by both providers and patients and caregivers, and more third-party payers are reimbursing providers for using telehealth and remote patient monitoring. This was really triggered by the effects on public health from the COVID-19 public health emergency. It also allows providers to monitor and prevent serious complications in remote locations or locations that have difficulty with access to care. Next slide, please. So here are some examples of the many common conditions and symptoms that can be managed with remote patient monitoring. Certain health conditions, especially those listed here, pair very well with telehealth when patients need to be monitored. It can also prevent health complications in patients who aren't able to travel easily or access care easily. For example, patients with diabetes can upload their blood glucose levels directly into a data file, and patients with high blood pressure can upload their blood pressure readings. This list is not all-inclusive. In fact, the possibilities are endless. Next, we will show you how Minnesota, Wisconsin, and Michigan are doing in comparison to national providers when it comes to remote patient monitoring. So this shows at a glance, and remember, this is Medicare only data. We do not have data for third-party payers. This just gives a snapshot of the numbers to draw assumptions from other payers and populations. This particular snapshot was done from March of 2020 through February of 2021. And the data was downloaded and aggregated from stratified categories from CMS website. You can see that across on the first column, nationally on the bottom, 21,344,992 eligible patients received telemedicine services. That was out of, in the second column, 42,381,111. So 50.36% nationally of all Medicare Part B beneficiaries received a telemedicine service during that time frame. You know, Michigan, Wisconsin, and Minnesota are compared in the numbers above. Michigan and Minnesota were above the 49%, Wisconsin at about the 38%, but I know there are a lot of things in place across the nation, not only these three states, to improve and increase the use of telehealth and remote patient monitoring. Next slide, please. Excuse me. We're going to go over the steps necessary to set up remote patient monitoring so that you can help your patients have more positive outcomes. Some examples that are listed on the left of products such as weight scales, pulse oximeters, blood glucose monitors, blood pressure monitors are familiar to patients, and they may not need a lot of explanation to use. However, don't assume that your patients know how to use the device, especially how to appropriately record or upload their data. Other devices like those listed on the right may be more high-tech or confusing to patients. Even simple machines can be overwhelming and need meticulous planning for them to be successful. And, you know, it's just amazing the things that we can do remotely at home. And we'll get a little more into that, you know, down the road at the end of our presentation. But, you know, dementia, Parkinson's, breathing apparatuses, fetal monitors, heart and apnea monitors. So just, you know, the possibilities are endless. Next slide, please. So one more short video providing an example of how organizations are using remote patient monitoring to help their patients meet their goals.
Mrs. Lee was recently discharged from the hospital. Her doctor ordered remote patient monitoring equipment to be delivered so Mrs. Lee can track her vitals at home. She's been on the program for about a week and a half when the remote monitoring nurse notices that Mrs. Lee gained 5 pounds in 2 days. She calls Mrs. Lee to ask about this weight gain and finds that Mrs. Lee has questions regarding the dosage of her prescribed diuretic medication. The nurse explains Mrs. Lee's medications and diet protocol. With her new understanding, Mrs. Lee's weight quickly returns to an acceptable range. Mrs. Lee's participation in the remote monitoring program has assisted her in avoiding a clinic visit and potential ED visit. Remote patient monitoring provides monitoring and support at home to help patients reach their healthcare goals.
Thank you, Lori. I love the little yay, yay from the nurse and the patient both, because that's what we feel like when, patients reach their goals, like we did it and we didn't have to, do something really, out of just monitoring at home. So on this slide, in order to successfully impact our outcomes and receive payment, your patient really first needs to understand why you are prescribing their at-home or remote patient monitoring. So the first thing you want to do, which isn't listed here, but is to have a discussion with the patient and their caregiver to determine if it's feasible for the patient to be set up with remote patient monitoring. So discharge planners and nurses are key to assessing the feasibility of remote patient monitoring in hospitals. That doesn't mean that nurses and care staff from clinics and other settings can't assess that as well. So if they are appropriate for remote patient monitoring, the first thing to do is educate them about the benefits of remote patient monitoring. Make sure that the patient understands that when used appropriately, remote monitoring can increase their access to care, reduce hospitalization, shorten their hospital stays, and decrease emergency room visits. Patients who use remote patient monitoring can also experience better health outcomes. This is especially true for those in rural or remote areas. They can experience better management of chronic conditions and preventive care, decrease exposure to communicable diseases, especially with COVID-19 pandemic. So it may be helpful to provide those details and benefits in writing, what to expect and what steps they might need to take to maximize their benefits. Next slide, please. So as patients need to understand what they need to do and what type of data you're expecting from them, they also need to know how to send it to you. So it is extremely important that they have written step-by-step instructions on how to use the device and how to send the data. We recommend that you follow up with an email or mailed document explaining the steps for their remote patient monitoring device, unless you can give it to them in the clinic or setting you're in. So these should be provided in the method of their preference, either paper copies, email, or a downloadable PDF. And before they begin using the device, it's probably the best practice is to schedule a telehealth appointment to go over these steps. Teachback is really important also. And finally, schedule a follow-up telehealth appointment after they've been using the device for several days and see if they're able to upload the data accurately or if they have any questions. And encourage them to bring their questions to that telehealth appointment. Next slide, please. So this section provides a brief overview of billing and payment of remote patient monitoring. Next slide. Medicare uses the term remote physiological monitoring in their coding and billing language. Remote physiological monitoring is a set of codes that describes non-face-to-face monitoring and analysis of physiological factors used to understand a patient's health. For example, the remote physiological, and I'm going to call it patient monitoring from here on, the remote patient monitoring codes allow remote monitoring of oxygen saturation levels in patients with COVID-19. You can use CPT codes 99453, 99454, 99457, and 99458. Next slide, please. Excuse me. While private insurance companies set their own terms, Medicare has its own payment policies. An established patient-physician relationship is required. However, there does not have to be an established relationship between that patient and physician for the duration of the public health emergency. So what that means is that you can establish your relationship at the time of the telehealth visit. Secondly, you can obtain consent to receive remote physiological monitoring services at the time services are furnished. There is no prior authorization or consent required. And third, any clinician, including physicians and non-physician practitioners who are eligible to furnish evaluation and management services, may bill Medicare for remote physiological monitoring services. Next slide, please. Some guidelines for remote physiological monitoring services billed to CPT codes 99453 and 99454. The device used to collect and transmit the data must meet the definition of a medical device as defined by the U.S. Food and Drug Administration. Secondly, the remote physiological monitoring service must monitor an acute care or chronic condition. Third, the services may be provided by auxiliary personnel under the general supervision of the billing practitioner. Next slide, please. Some guidelines for remote physiological monitoring services billed to codes 99453 and 54 continued. The data must be collected for at least 16 out of 30 days, with one exception. If a patient is suspected or diagnosed with COVID-19, data can be collected over as few as 2 days during the public health emergency for COVID-19. Secondly, data must be collected electronically and automatically uploaded to a secure location where it is available for analysis and interpretation by the provider. And below this is the link to Medicare coding requirements for remote physiological monitoring. That is a very important page to visit if you are planning a new to remote monitoring billing. So remember, the biggest point is that remote monitoring is different than a portal message with patient reporting blood pressure, blood sugar, or weight. This is actual physiological data being uploaded. And third-party billers. When it comes to third-party billing, you'll need to check the patient's insurance company for their policies on billing and reimbursement. Each state's Medicaid program has their own billing and reimbursement policies, just like they have different policies for who can do what in practice. States have different rules on who can perform and bill for certain remote patient monitoring activities. So make sure you're following your state guidelines on who can legally perform those services. And we've also included the link to the National Policy Center for Connected Health Policy. With the links here show a comparison between Minnesota and Wisconsin rules for telehealth and reimbursement. And that, I think Mona just uploaded that link to the chat. And you can also take that link, go to the link and compare any two states, state by state, or you can look specifically at your state on the policies of billing.
Mm-hmm. Lisa, I just wanted to just let the audience know that all of the links are available in the PDFs of the slides. And so any of them can be accessed that way as well. So,
Great. Thank you. And we'll talk about the clinical application and resources here for remote patient monitoring. So I'm going to, the next page or will show some really good resources. And these are Medicare clinician services. So basically these services are temporary telehealth services that were put in place for the pandemic. So during COVID-19, and as we all know, the public health emergency expires on May 11th. And so CMS has decided to that the temporary telehealth services added during the pandemic will continue through the end of this calendar year. At this time, more to come in the future. You know, we don't know if they'll continue it beyond that. There's been really positive feedback, I think, from consumers and providers. And we hope that many of the telehealth and features will continue beyond. So telehealth services provided in the office setting will continue to be paid at the non-facility rate, which is higher payment through the end of this year. And CMS will not implement new codes for remote therapeutic monitoring as initially proposed. However, Medicare hospital outpatient services, the CMS finalized a permanent policy allowing clinical staff of hospital outpatient departments, including critical access hospitals, to provide remote behavioral health services to patients in their homes. Well, that's really good news. We all know the mental health crisis that we're having, and that is this behavioral health service extension is good news for our mental health services. And home health agencies. CMS is now adding new billing codes for home health telecommunication technology. Agencies may voluntarily report the codes starting January 1st, 2023, but as of July 1st, they must report those codes for telecommunications. Next page. There's another link to a video with a short explanation of the content, and it's CMS's 2022 final rule for remote patient monitoring. And that is presented by ThoroughCare, and that's, you can view that on your own, but it's a very good overview of the remote patient monitoring final rule. Just a plug-in for Superior Health Connect. As I stated earlier, I work for Superior Health Quality Alliance, which works with Minnesota, Wisconsin, and Michigan. We have a Connect program that's a shared learning environment for Superior Health participants to come together and foster and promote an all teach, all learn climate that provides framework to improve and sustain mutual healthcare quality improvement initiatives, both locally, regionally, and nationally. So you can either scan with your phone on this page or on the PDF, or you can, directly link to our site, sign up for free, join whatever groups you want to join. It's kind of like this powerful professional chat sharing environment where people share resources, and really, really good involvement from our participants. And you can participate as little or as much as you would like to on the Superior Health Connect. Next page. And some more references. Oops, I'm gonna page down to this. In response to the increased use and expanded coverage of telehealth during the pandemic, From Coverage to Care, or C2C, has released new resources to support patients and providers in making the most of virtual care. Just click on the resources below and share this information with your communities. They're great resources. The telehealth for providers, what you need to know, how to use and when to use telehealth. That's where most of this, our recommendations came from. It's basically a step-by-step with a little more detail on how to keep up to date on telehealth payment and tips for how to start your telehealth programs. Next page, please. And then we have 2 pages of reference for remote patient monitoring resources. Just lots of stuff out there on the website. Don't try to reinvent the wheel. telehealth website for providers, the resources, the implementation playbook, Medicare fact sheet, telehealth FAQs from CMS, which is probably that telehealth FAQs has some pretty specific questions. I think that's a really good resources to look at. Of course, the list of Medicare telehealth services, the response to the public health emergency, and general telehealth webpage for Medicaid.gov, which is Medicaid state by state. And then the next page, there's more resources here, the state plans, state Medicaid telehealth toolkits, best practices on providing remote assistance. There's some rural resources here, the rural crosswalk for CMS flexibilities to fight COVID, the rural telehealth toolkit, and then the rural FQHC telebehavioral health guidelines. Very, very good resources. And I would encourage you to, just click on one or two or three of these if you can, and just whatever your organization is, you should be able to find some great resources. And I think one more page, questions. And that concludes my presentation on telehealth, what's happening, but we have a great scenario overview from Mona Matthews, who is part of Wisconsin's program, and she's going to share a story about how remote patient monitoring and actually a remote hospital was used for a family member.
Yeah. Thanks, Lisa. And I love your examples, and the videos really outlined, for chronic disease monitoring, the use of telehealth, and also when there's infection and worry about like COVID, and to keep healthcare providers safe. But my example is a hospital at home example. And I'll start by saying that this is, I'm by no means an expert on how they do this or how they bill or anything like that. This is totally a layperson's example. So as a family member, I have a niece who has severe cerebral palsy, and she is nonverbal and non-ambulatory. She doesn't walk. She doesn't really communicate in any way. And she recently had a pretty bad infection. She was down to 85 pounds. And if she is able to stand, she's probably close to about 5'8". So 85 pounds is pretty small. She had some sort of infection, and she was in the hospital for a couple of nights in the hospital, but her father needs to stay with her to help. And it's extremely traumatic to her to be in a different environment. So they were transitioned to the Mayo Clinic hospital at home program, where they brought the IVs, everything just like you would think a hospital room would look like, with everything you need to care for a patient, but they were able to do this remotely. There were nurses that came out a couple of times a day, but she had all of the instruments to check her vitals remotely, to run the IVs that she was needed, and then the nurses would come a few times a day, of course, to what me as a layperson, I would say probably to change out the IVs as they ran out, and making sure that she had that continuous care. And she was in in the hospital at home program for about a week, maybe a little over a week. And then it was just like a regular discharge. She was discharged from the hospital. And the program is considered to be the patients are an inpatient during that time period that they're using the hospital at home. But using that remote way of doing it gave her the ability to be in her own environment. For a person who probably is she is very traumatized when she isn't in her own environment, and probably got better a lot quicker than she would in the hospital at that time. So that's another example that maybe takes it even to another level. And I know other people in the area where I live who have been using the hospital at home, like for COVID symptoms too. So the COVID certainly advanced all of these technologies.
Absolutely. Thank you so much for sharing that story, Mona. I think it's a great example of where patient monitoring can go in the future. Lisa, I just had a couple of questions for you around things that have come up as I've talked to clinics and healthcare providers. Can you talk at all about sort of the consent process or what the requirements are from a consent standpoint for remote patient monitoring?
So that's a great question. You can hear me okay, right?
Mm-hmm. Yes.
Okay, so the consent process is basically consenting to the terms as outlined by CMS, and I believe CMS has some resources on the consent process. And also you need to be, because you're transmitting material across waves, you want to make sure that you have a program that is, or a platform, I should say, that is secure. So it's assuring that the patient understands that this is on a secure platform, that their information will not be shared, and that they're agreeing to have their information, going across waves, because they need to know the risks. Of course, with any platform, even though it's secure, things can be hacked, and also that this information will not be shared with other people, basically like a HIPAA policy. So your state may have a more limited. I know Minnesota has some pretty significant HIPAA rules that we do above and beyond what Medicare does. So making sure that you're, following your state and CMS rules on assuring data privacy.
Thanks so much for that, Lisa. That really helps just to kind of understand. One other quick question is, who can furnish remote patient monitoring and bill for it? Is that based on credentialing, or is that state specific? Would you be able to sort of elaborate on that a bit?
So yes, anybody who can do evaluation and management services, which includes, nurse practitioners, physician assistants, they need to, be able to bill for those services in order to be the provider for that service. So if you have speech therapists, even physical therapists that are able to bill for E&M services, they should be able to provide these services on the remote monitoring. Psychiatrists, mental health providers, depending on their licensure within their state. I believe that Minnesota and Wisconsin have different E&M, what advanced practice nurses can do from state to state. So, again, following your state guidelines, which is why it's important to look at who can provide what services. And I do believe that's spelled out in that state by state comparison.
Very good. All right, Mona, was there anything else or anything in the chat?
I don't see anything else in the chat. And I don't think it's a bad thing if we're, if we've covered everything. I think, Lisa, you did a great job.
Yes,
thank you
so
for
much,
having me. This
Lisa.
is really fun to talk about. It's dear to our hearts because I live in a rural area, as do many of you. And access is a big issue, and to get access to customers, patients who would otherwise not have access is a great thing.
That's very good. Yes, that's very true. And I just wanted to say thank you to everyone who has joined us today or is watching the video, and also wanted to invite you to next week's session where I will be presenting on patient privacy and access, and some tips around patient access to their health information, as well as some security and privacy tips as well. So with that, we'll close today's session, and thank you once again. I also have put in the chat, we will be sending this out as well, a link to our survey. We would love to hear from you. and receive feedback on what you thought about the information presented on today's program and any future topics that you'd be interested in. Thank you so much, everyone.